Welcome to the Dr. Diane Show, where we explore revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. With over 20 years of expertise as a mindset warrior, perspective shifter, and unshakable optimist, I am dedicated to helping you reach your wildest dreams in business, health, performance, and relationships. Learn about the power of thought and how it shapes your life to take risks, change careers, find love, go on adventures, and live passionately with me, Dr. Diane. Get ready for revolutionary ways of thinking, being, and creating an amazing life. The Dr. Diane Show starts now. Hi, everyone. I am Dr. Diane Hayden, and you are listening to the Dr. Diane Show on Transformation Talk Radio. Stay with us for the next hour, where we will explore revolutionary expansion of mind, body, and soul. Each time on the Dr. Diane Show, we have experts from around the country discussing cutting-edge topics on longevity medicine, natural health, mindset, soul purpose, to help you shift your mindset and become a mindset warrior like me. I'm excited today to have Dr. Lyndsey Maher. She is a licensed naturopathic doctor in Connecticut, as well as the owner and medical director of Soleil Acupuncture and Naturopathic Medicine in Hamden, Connecticut. Soleil is an integrative medical practice offering services such as IV nutrient therapy, craniosacral therapy, and non-toxic, minimally invasive aesthetic services. Their mission is to help their patients feel better, heard, and validated. Dr. Lyndsey is a graduate of the University of Bridgeport School of Naturopathic Medicine and Acupuncture Institute. She received her bachelor's degree in political science with all of the plans to attend law school, but while studying for the LSAT, she got sick again, resurfacing her frustration with conventional medicine's approach of rinse, wash, and repeat. This is when a Google search prompted her in the direction of naturopathic medicine, only to find one of a few schools in North America right here in her backyard, University of Bridgeport in Connecticut. It was, of course, meant to be, so her trek to naturopathic medicine began. So welcome, Dr. Lyndsey. How are you today?
Thanks. I'm good. Thanks for having me, Diane. I appreciate it.
Yeah, awesome. So we just learned a little bit about you in that great bio, and that's normally where I want to start. I mean, usually my listeners are very curious about how my guests got into the work that they do and their journey and all of that. So let's elaborate a little bit. So it sounds like you were pretty much on the path to pursuing a law degree, and then what happened?
So I have to be honest, I as a child, that was my goal. And so of course, ever on the search and path to pursue that. And I actually tried to switch at some point in undergrad because I was like, this isn't really for me, but here I am, I'm already moving in that direction. So I might as well, finish it up. But I graduated my undergrad just after the 2008 financial crisis. And what was happening was a lot of students my age who were graduating and kind of entering into their professional realm were unable to find work. And so most people were seeking kind of, I guess you could say, sanctity in graduate school programs because, the looming 6-month payback for student loans was on the horizon. So I think I read an article that said something along the lines of, we're becoming human inventory in graduate schools. And so I was like, am I doing this for me? Or am I doing this for, the potential worries, like, all of those things. And so not really super satisfied with that decision. I was working in an administration at a local university, and just nothing was sitting right. I had chronic sinus infections growing up, and one had come back. It was probably the first since before I went to undergrad, because I was in Arizona. And so I noticed that I didn't really tend to get infections while I was out there. And it was only when I came back to the East Coast. So, I'd called the doctor, and they're like, well, we kind of have to make it so that you, if you get worse, call us back, kind of a thing. And so my boyfriend, ever so supportive, said, you know what, well, why are we going to wait till it gets worse? Why don't you try to figure out a way to ameliorate everything now? And so I said, okay, that kind of makes sense, right? So I did some searching. And after that, while it had taken a little while to get over it, longer than had I been prescribed an antibiotic, I said, you know what, I actually feel better having let it work its course than had I just kind of interrupted it somewhere in the middle. And so I was like, wow, I was kind of like amazed at what few things I was doing, but also how simple they were. And so I had, continued to do searching, and I found the Association of, or the American Association of Naturopathic Physicians, and they laid out all of the schools that were in the United States. And as I'm reading this, I'm like, oh my God, this is so great. But there's no way anything like this is around me. And so when I got to the page with all of the schools, I was like, Bridgeport, as in like Bridgeport, Connecticut. And I was not a place to relocate at the time. So I said, okay, I got an appointment with the admissions department, figured out what I needed to do. And because I was a political science undergrad, I had no basic sciences. And so I had to do 2.5 years of prerequisites before I could even apply to the program. But yeah, it was definitely a whirlwind.
That was my path actually, because my
Yeah.
undergrad's in marketing. And then
Okay.
I decided to go back for exercise physiology for my master's and my doctorate. And exactly
Mm-hmm.
the same thing. I had like 2 years of all this
Mm-hmm.
undergraduate work I had to do, which I feel like, the good side of that is it's almost like a test. Like, okay, how bad do you really want this degree? Because you're gonna have to go
Yeah.
back and, do all this stuff to even begin, where most people typically start. So that's a great story. I mean, it's so many times I have talked to naturopaths and all different kinds of holistic practitioners who had went down some, had either a chronic health issue or something happened to them, and that kind of led them to the field that they're in and what they're doing. So besides naturopathic medicine, you're also a licensed acupuncturist. How did you get interested in that?
So it's kind of interesting, and it seems more along the lines of a business plan was really kind of where it fit in initially. Someone had pointed out to me that with naturopathic medicine, my patient flow would probably be like every 3 to 6 months, as compared to patients with acupuncture, it'd be maybe more weekly or semi-regularly. So I said, okay, that makes sense from a business standpoint. But as I got into the program, I thought it was fantastic, especially because we live in a world of polypharmacy, and some patients come in and they're on so many medications that I wouldn't even know where to begin because something might interact. And so acupuncture fills that void because it's pharmacologic, it's non-supplemental unless you get into the herbs stuff. But after that, I see the effects that it has on people, and it's a big part of my fertility practice.
So I want to talk about that for a minute. I mean, we're definitely going to go back to all the good stuff that you do with naturopathic medicine, but I feel like I want to focus on acupuncture because I think so many people still have this negative impression about how it feels, what it is, or they really don't even understand it. And it's funny, like, it's 2023, we're talking about this. When I started my magazine, Natural Nutmeg in Connecticut in 2007, I thought everybody knew about all these modalities. And, come to find out it was because I'd been in, natural medicine for years prior to that with, my degrees and then working for two different nutritional supplement companies. So I just assumed like, oh yeah, everybody knows what acupuncture is. And it was amazing when I started, having people write articles and things like that, that there were so many readers that would ask, send me questions or even approach these practitioners and be like, I've always been afraid of acupuncture. Doesn't it hurt? What does it really do? It's kind of like, this like spooky kind of thing. So
Oh,
explain
yeah.
a little, first of all, I mean, and I've had it done, and actually you've been my practitioner for an acupuncture treatment. And I can attest that it doesn't hurt at all. I mean, half the time you don't even feel the little tiny, I hate to even call them needles because I think that's what freaks people
Yeah,
out, but
boo. Mhm.
you can't even feel it. I mean, honestly, it's like they're so like minuscule. But tell us a little bit about, what the theory is behind it and your experience with, what does it feel like to get acupuncture?
So it's a thousands-year-old school of medicine, right? And it started obviously in China. I actually shouldn't say obviously, because as you said, a lot of people are not really familiar with all of the details and the ins and outs. And we just kind of say acupuncture, and I think we do make that association with needles. But the whole practice of Chinese medicine as a whole is not limited to acupuncture. That's just one modality, right? Just like medicine has various sects, you have surgery and you have, your primary care doctor and your cardiology, and that kind of all foundationally makes a sect of medicine. In Chinese medicine, you have your herbalists and you have your acupuncturists, and similar kind of outline, if you will. And so the theory is based on 12 meridians or channels that go up and down your body, starting at various points, usually starting at either the tips of your fingers or the tips of your toes and ending somewhere else on your body. And some people have been told or have been familiar with things like acupressure, like if you apply pressure here, it'll help with something, right? And that's works because those specific points are so shallow that we can access those points by just touching them. With acupuncture, we're using a needle that's acting as a conduit because some of these points are just too deep within the layers of our body that we can't access them with just touching. So while the needles can maybe feel like a pinprick on insertion, we never like for them to be sharp and shooting pain. But oftentimes our goal is to get some semblance of a heaviness or an achiness or a dull sensation because we've activated the channels and we've turned on the points. And so all that is very normal and natural. And it's always very important to make those claims or make your patient aware of them, because I do think that people feel something and just assume that it's wrong.
Yeah, correct. I think, although I have to say, there are certain points on my body where I've had acupuncture, and I honestly haven't even felt, it's almost like I feel like a little bit of like someone's touching me or a little pressure or whatever, but there's no prick or anything like that. So I think that, just telling people, letting people know that it's not like, it's not going to be extremely painful or anything like that at all, to get them kind of past that fear so they'll at least try it. Because I think there are so many benefits to it. It's amazing.
Yes, but we do, sometimes we'll have people call and ask about acupuncture and they'll say that they're deathly afraid of needles. And I've just gotten to a point where I'm like, there's no point in trying this. We're not going to get past that, right? I wish we could, because as you said, there's so many benefits. But yeah, if that's initially when I got into practice, I was like, oh, maybe we can kind of break them out of it. But nope, I've learned I made that mistake one too many times. Like if you do have a phobia of needles, it's probably not for you. But I will say that I get a lot of people with tattoos who are afraid of my needle.
Now that's pretty amazing.
Yes.
Like you can go get a tattoo. Now I don't have
exactly.
any, but from what I've heard, that's painful.
Yeah, exactly.
You know what? It's all about like that what that message says to me is like, it's all about how bad you want something. Like you want that tattoo, you're going to deal with the pain. And so maybe it's just about having people realize I think it's more about people understanding and realizing what the benefits of acupuncture can be that will get them past that fear, let's say, and, and decide to try it. It's more about understanding, how this can help me. So this is absolutely fascinating. We're going to get into a lot more about what you do, Dr. Lyndsey. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. We're going to take a quick break. When we come back, we'll explore more about naturopathic medicine. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. Before we continue, I want to make sure everyone knows how to contact me. You can find me at either www.drdianehayden.com or either of my two publications, www.naturalnutmeg.com and www.essentialnaples.com. And you can learn more about Dr. Lyndsey at www.soleilholistic.com. That's spelled SOLEILHOLISTIC.com. So welcome back, Dr. Lyndsey. We were talking about helping people get past the fear of acupuncture and learning a little bit more about, what it can do. Just real quick, I thought it might be helpful to tell people, why I initially had gone for acupuncture. And that was because I had been having like some arrhythmias and, PVCs and just kind of like a mild, sometimes irregular heart rate. And I had gone through the whole cardiologist route, and they couldn't find anything. There's nothing structurally wrong or anything like that from a cardiovascular perspective. And so basically it's like your issue, with going down the traditional medicine route, and they can't help you. And then you're kind of like, well, what do I do now? I just like live with this or whatever. Someone suggested acupuncture. And the first time I had these episodes, I'll call them, was probably like 10 years ago or so. And I went for about 2 to 3 months of acupuncture, and it completely went away. And so I was amazed, and I didn't change anything else. I had tried other things like taking more magnesium or B vitamins and stuff like that. Nothing had really worked. And so, I mean, I attribute it 100% to that.
Yeah, our first year of med school, actually, in naturopathic side of things, not even in acupuncture, we were broken up into small groups to do presentations, and we were in our cardio section, and our topic was arrhythmias, and acupuncture has actually been known to create cardioversion and is able to get people back out of, even in like very acute settings. They have found the research to support that too. So it's not a surprise that it would work for you in less of an acute setting, if you will.
Yeah, yeah. I mean, it makes sense if you're thinking about energy, right? And to me, I mean, it's part of what I think it is, or it might have been related to, is honestly just stress. And, in terms of my brain sending messages to, my heart, as far as the electrophysiology, just the way that your heart beats, it would make total sense that you could correct that or help it with acupuncture, because you're dealing with the movement of energy throughout the body.
Mm-hmm. And, symptoms or experiences that we have are all just our body telling us that there's something that we need to address, right? And a lot of times when we get sick, even just in an acute setting, we're kind of like, oh, who got me sick? Or it must have been this or must have been that. So instead of looking at, maybe we're working 7 days a week, we're working 12-hour day, so instead of looking at those things, we're then looking to see like how we can blame or who can blame or where we pick something up from. But we rarely can look inside of us and kind of explore, okay, what is this telling me? And what can I do, to make sure that this either kind of gets nipped in the bud or doesn't happen again, or doesn't happen again for a while.
Right. Yeah. I mean, it's all about listening to those messages that our bodies are telling us, for sure.
Yeah.
For sure. So you have your own practice.
Mm-hmm.
Did you know that you always wanted to open your own naturopathic practice as opposed to, going to work for another group?
So I did, even back to the days when I thought I was going to be a lawyer, I always wanted to have my own practice there too. So I think I always knew I wanted to have my own business. Just kind of went a little differently this time.
Mm-hmm.
But what I did know was that I didn't want to do it right away. I felt like I didn't have the infrastructure in place to help me. Like you said, you went to school for marketing, that's serving you well now, right? Like my poli-sci undergrad degree is serving me in some ways, but I don't have any business background. I don't have any marketing background. I don't have anything along those lines. And so you don't realize how much or how important those things are when you do open your own business. So I had matched with a residency site in Connecticut, and it's one of a few because naturopathic doctors don't have many residencies, since allopathic doctors, medical doctors, their residencies are funded by the Centers for Medicare and Medicaid. And because Medicare doesn't acknowledge naturopathic doctors, we can't force residencies upon graduates because there's not enough money. They're independently and privately funded. So I was fortunate to have been matched with a site in Connecticut. Oh, this would be a great opportunity. It's a year, kind of cover the things I didn't get in school, give me a little bit of an umbrella to be able to grow as an independent practitioner outside of being a student. And then my thought was, maybe I would stay on as an associate for a couple of years and then open my own practice. Well, everything changed when COVID happened. Medicine looked very different. It was not happening in person anymore. It was all virtual. And, I don't want to belittle, the way people pivoted, but I didn't need a residency to teach me how to talk to people over a computer, right? So I needed to figure something else out. And so I'm also certified in facial acupuncture. And I figured if I was in that practice simultaneously, I could still see patients outside of that. And so I had found a small space and I said, this would be perfect for that. But lo and behold, all the things that were happening behind the scenes, I ended up leaving that position and just kind of went into my business. Not really a business plan in place, just a lot of hopes and dreams.
Yeah, well, but I think that that's the story for so many holistic practitioners, isn't it? I mean, unfortunately, none of you really get business or marketing training. And it's like, you go to school for your specialty and to become an expert in that, and then you get out and all of a sudden it's like, oh, wait a minute, I have to, I have to I have to be an entrepreneur as well and
Mhm.
figure out like all these other things that I have to do. But I mean, that's part of why I started Natural Nutmeg was to help people exactly in your scenario, to kind of take that load off of you, to be able to do, some of the marketing for you and help get your name out there. And so that gives you more time to do what you love to do. So I think it's common, it's very common that you kind of have to juggle all these balls and figure it out as you go, for sure. Um, so tell me a little bit about, what are all the different services that you guys have at Soleil? I mean, obviously naturopathic medicine, obviously
Mhm.
acupuncture, but what are the
Mhm.
things do you guys see patients for?
So initially, when we opened, I had asked my cousin Christina to kind of get involved with me. She's an acute care nurse practitioner and she was working in the hospital at the time. And the scope of practice for naturopathic doctors in Connecticut is very narrow. And one of the things, despite being well educated in minerals and nutrients and vitamins, we cannot infuse them or give injections. And so I felt like this does a disservice to patients. I saw it work very well in the student clinic, and I thought it would be a miss to not be able to offer something like that to my patients, especially people who need a really rapid repletion that you're not going to get from oral supplementation. So she agreed. And so we have IVs. We do a lot of things for a lot of immune supporting during the winter months for colds and flus. We have some nutrient cocktails that help with people or support them in their weight loss endeavors and without any of the harsher, long-term side effects that some people might experience. We took on an associate this year who's not only a naturopathic doctor, but she performs craniosacral therapy. And so I thought that was a really good adjunct and complement to acupuncture because, as we just said, not everybody is a big fan of needles. So oftentimes I now have an option when people call, or at least my front desk, and say, okay, well, if needles aren't for you, I think you can still get the same benefits from light touch therapy from a craniosacral practitioner. And so we have that to be able to offer to our patients too. And as much as naturopathic medicine is root cause medicine to work on the inside, people still want to really look refreshed and look great on the outside because that's what we see. There's instant gratification when you look in a mirror, right? Or there's
Mhm.
the opposite. And so I think part of feeling good internally and physically is also feeling good and confident about how you are on the outside. So we do offer some microneedling for collagen induction therapy, and then my cousin also does some dermaplaning, which is an exfoliating treatment. So we're kind of breaking into that area too. The idea being that we're not really doing injectables, but we're still able to provide a non-toxic solution that is just as effective.
My gosh, awesome. One-stop shop. I can go,
Yes.
if I'm having a chronic health issue, I can go
Yeah.
there. And then at the same time, I can do some, things that are more aesthetic that, like you
Yeah.
said, will help me feel better.
Hmm.
In terms of just the, visually, the way that we see ourselves physically. Which I agree with. I mean, you want people to focus more or to be more, I guess the word is, concerned about their inner health, that what's going
Hmm.
on inside their body. But, and most of the time we are, but also, you can't help but feel like, oh, but I also like to feel better in terms of the way that I look. So I love that you guys offer both.
Yeah. And, my cousin even says, she said, IV therapy is not a cure all, but if you are dragging and you're fatigued and you can't even get yourself to the kitchen to make that healthy meal, we can help support that, so sometimes you just need something that kind of kickstarts or jumpstarts your journey a little bit because you're just not feeling the motivation. And so again, not going to be a cure-all, but yeah, if you're feeling good, that gives you the ability to do the things that make you feel good or are good for you.
Yeah.
And we do share a lot of patients, and I do like that. So it gives you a very comprehensive medical approach. So I have patients I refer to my other provider for craniosacral, but see him for naturopathic medicine, or we refer to Christina to support detoxification pathways, and so then you're getting 3 different, views on your health. And I think it just creates a very comprehensive approach.
Yeah, that's awesome. Um, do you have a particular, I'll say health issue that you specialize in or that you find for whatever reason people are drawn to you for, that you are really passionate about treating?
So while I don't think it's necessarily a condition, I think it's more the individual. You had mentioned in your intro about how, a lot of your podcast is about cultivating kind of this environment for yourself and kind of attracting the things that are in your orbit and match you. And so we're a cash-based practice. So we've already kind of set ourselves up in a way that kind of meet or appeal to certain people. And so those people are usually really ready to get their health goals in order and their health house situated. And so while it's not specific health concerns, I do see a lot of individual things. I think it's mostly an energetic match for my patients, really. And because if your patient feels supported and heard and feels like you are on their team and not just talking at them, but with them, it doesn't matter what the health concern is, you're going to get them to reach their goals. However, I did mention a little bit earlier, I do see a lot of fertility patients in practice. It just seems to be what's happening. I didn't mean for that to happen. It just kind of did. And now I did take a little bit of a hiatus over the summer on seeing new patients and then resumed again in October. And now, like, most of my patients are the husbands of the women who are going through fertility stuff. So it's pretty cool to see that evolve.
Yeah, yeah. I think it's so interesting. I mean, I've talked to a lot of naturopaths and different types of holistic practitioners that said, I started out, I was like so excited about working with people who had like IBS, let's say, or I was into
Mhm.
digestive issues or whatever. And I got all these patients that were, that had infertility, or I got all these patients that had some other like Lyme disease.
Mhm.
And so it's like, wow, it's so interesting. It's for whatever reason, the way that energy works, I think, or the way the universe works, it's like
Mhm.
people come to you for a reason. And it could be you could have set out with a completely different idea about how your practice was going to look and what kinds of patients you were going to see. And then what ends up coming is something totally different because that's where you're supposed to be. Like that's who you are really able to help.
Mhm.
So yeah, I think it's cool. I mean, whether it's infertility patients and you're seeing both, both partners, which is awesome, or whatever it would have been. But obviously, for some reason, these types of people are drawn to you.
Exactly. And honestly, I think it really helps with compliance purposes,
Right.
and so it's and then the principles are simple. And as I mentioned, when, I had gotten sick that time that made me pivot in my life, healing and health don't have to be hard. They could just be simple. And so it could be any case or concern. And so long as you're just applying the principles and not trying to overcomplicate it, I think you're going to get your patient to where they need to be.
I love that you said that it should be simple because I feel like so many times, whatever the diagnosis is, it's overwhelming for somebody to have that diagnosis to begin with.
Mhm.
And then all the things that they have to do. make it even more stressful, which is exactly the last thing that you want to be doing when someone's trying to deal with a health issue. You want to reduce stress because that's just going to make it worse. So I love the fact that your mindset is that it should be simple. I want to talk more about that, but we have to go to a quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Dr. Lyndsey, who is a naturopathic physician. Stay tuned. We'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden, and I am talking today with Dr. Lyndsey Maher. You can learn more about her at www.soleilholistic.com. That's spelled SOLEILHOLISTIC.com. And before we just went to break, Dr. Lyndsey, you said something that I was like, we have to talk more about this. You said, health and healing should be simple. And I don't think that that is the general consensus at all. I think people think about anything, whether it's even just like simple weight loss, as it's going to be difficult. It's going to be hard. To, let's say I've got like a really, serious chronic health issue or diagnosis or whatever. It's going to be difficult. It's going to be hard. And so I want to come back to that mindset that you have of, healing should be simple. So let's talk a little bit more about that, because people are probably like, how is she saying that?
Well, we're so inundated by so much information that it's hard to not think things are going to be complicated or require all of these, these 5 steps, these 12 steps, these 15 steps, all the things, or this group coaching thing or that, or someone has the secret to this and whatnot, I think there's a lot of clickbait out there too. And so I think then it makes you feel like you're not doing enough, whatever it is that you're doing. But not only is the healing aspect, should that be simple? I mean, we've totally taken medicine and made it complicated too, just like the diagnostics part of it. Whatever happened to a good old physical exam, right? Like, why are we not putting our hands on patients? Like, my mom a few years ago during COVID wasn't feeling well. And she, the doctor wouldn't see her, even though she tested negative for COVID. And so they still wouldn't see her in the office. And she's like, well, I don't know how you're supposed to help me, but okay. Instead of doing an abdominal exam because they were not in the office, they sent her out for a CT. And so they sent her, I was like, that just seems like a little hard hitting, right? But if everything's a nail, you're good, or if you're going to, or if you're a hammer, everything's going to look like a nail, right? So, but for what the CT to show that she had inflammation in her GI, okay, great. She knew she had stomach upset, right? But like, that doesn't tell us anything. That was unnecessary. It was also an expense, So exactly. I think that's the other part of it, is not only are we making it complicated, we're making it very expensive. And, I want people to realize, though, yes, if you are to work with a provider like me that is cash-based, it's more of an investment and not an expense. And those words are like, to put those in replace of each other, that's a very important mindset shift in and of itself, and how you kind of view health and wellness, right? So instead of saying healing is hard, healing is simple. And, I think then if you say that enough times, you will kind of, what you think about, you bring about. And so then that will kind of come and help. And that's always goal setting and intention setting is actually a big part of my healing process in the office and with my patients. And I find that a lot of people, once they reach a certain age, don't have goals. And so it's really hard when you don't even have goals in your own personal life. How can you have goals in health? And so people just, if they feel crappy, they just know they want to feel better, but they don't know what that looks like. And so that's where I think it becomes the difficult component, and the lack of simplicity fall victim there.
Yeah, totally. And, you're right. It doesn't have to be, I like your approach, because I think sometimes not every naturopath and not every holistic practitioner has your mindset. Like I know, because I've been to some of them, or I have, friends, or talk to people who've gone to, different types of integrative practitioners, and they come out with like a laundry list of tests they have to do, and supplements they have to take, and lifestyle changes they have to make, and diet and whatever. It's like, yeah, okay, maybe the person does need to do all those things,
Mhm.
but there's no way that most people, 99% of the population, are going to be able to handle all of those changes at once. Like if you go through any kind of, coaching program or anything like that, typically what do they tell you? Like maybe start with like three things that you want to change, or maybe start with one thing that you want to change. So instead of giving people, this laundry list of stuff that they have to do, I feel like your approach is more about, okay, let's look at simple things that we can implement first that I'm going to get my patient to do. And then we can look towards, maybe introducing supplements, or maybe making some changes, or doing more lab tests, or whatever it might be.
Mhm.
But I think that's really comforting to hear for most people, that it doesn't have to be this enormous change that I'm going to make. Yeah, there's going to be a lot of changes that have to be made to get you healthy, depending on what the issue is, but you can make them slowly, or you can introduce them, one at a time versus all these different things at the same time.
Yeah, especially because if you're suffering with chronic illness, this didn't happen overnight, right? It happened over a long period of time. So I'm not saying it's going to take the same amount of time for you to heal that it did to get you sick, but also it's a marathon, not a race. And so we need to lay the foundations and the frameworks. And you can take all the right supplements and eat all the right food, but if your attitude is not in order, if your lifestyle is not in order, if your stress is through the roof, it doesn't matter. And so, sometimes, and I don't say this to belittle anybody, but I sometimes sit and think after I had an appointment with somebody, I'm like, I can't believe somebody just paid me to tell them that they need to sleep more. But they needed to hear that,
Yep.
right?
Yeah.
And so, and the light bulbs went off in their mind, and I said, okay, well, even though, but they needed that. And so every bit of that had value.
Yeah, absolutely. Absolutely. And you're right. Sometimes most of the time, probably we do know what we
Mm-hmm.
need to be doing. We do know
Mm-hmm.
that we need to sleep more, or eat better, or reduce our stress, but we keep, thinking, well, I'm still fine. I can just keep going at this pace, until you can't.
Mm-hmm.
Or like someone like you has to say, you really need to make these changes. I mean, how many times have we heard about perfectly healthy people having cardiovascular events or weird things? It's got to be because of stress. Because if they're eating right and the rest of their lifestyle's in check, that's huge. Or maybe they're not sleeping. It's
Yeah,
things
right.
like
And it's
that.
also it's also about moderation too. I call it the Goldilocks effect. It's not too little and it's not too much, right? It's this when everyone says, when you're scrolling through social media and you're like, this person says this is bad and this person says this is good. And it's not that this one thing is good or bad. It's just how much of it are you taking, or how much of it are you doing? Like drinking alcohol or coffee. There's something called the French paradox, where they drink red wine on a regular basis, but they're very fit and have low levels of cardiovascular disease. Is it the wine, or is it other things, right? But that's to say that and then there's the component where you shouldn't drink alcohol at all, and any drink is going to be bad for you. But it's about finding a middle ground for yourself. Not everyone has the same middle ground. And so that's another thing, is to stop comparing ourselves to everybody else, and especially in our healing journeys, because everybody is going to heal in different ways and at different times.
Yeah, for sure. For sure. So where do you see yourself and your practice in, say, the next 5 or 10 years?
So I was just having this conversation with my practice recently, and I want to grow into corporate wellness. And so my idea there is that I would bring health and wellness to businesses, to big businesses, because a healthy a healthy workforce is a productive and efficient workforce. And so I think that is, I think that's where things are heading to, because people are trying to make decisions for themselves, but the insurance company that their employer has opted to contract with doesn't really support their endeavors. And I see a lot more businesses are just now starting to self-insure. And so that's just along the same lines of thinking as for me, is that you're having, the importance of doing X, Y, and Z to get your business in this place so that it's free of any, theft or whatever the concern may be that costs the company more money than it is to produce the products that they're putting out. But the same should be applied to their people and their workforce, is that we should hold no bounds in terms of the health that the workforce should be allowed to have access to. And so sometimes that does mean going to businesses, because a lot of people, they want to go home at the end of the day. They don't want to add another appointment to their task list. So while the business will grow in our location that it's at, I also want it to grow outside of there too.
Oh, so that's cool. So you would actually be like satellite. You would bring your clinicians, let's say,
Mhm.
and your services to the company versus
Yes.
having the employees come to you. That's really cool.
Yes. Yeah. It would kind of be like a monthly or semi-monthly. It would depend on what the organization is looking for and the needs that they're looking to have fulfilled. But yeah, so that's been something that's kind of been in the back of my mind since even before I graduated, just and having worked in a big establishment that offered their own health services, but I didn't think it really fit the bill personally.
Right. Yeah, that is awesome. And I think a great service for, I think companies would totally be
Mhm.
wanting to take advantage of that for sure. What about, what would you say is the best part of your work?
It doesn't feel like work. Sometimes, and that
That's the
sounds so
best part.
cliche. Yeah, it sounds so cliche. But, I read something somewhere where it's like entrepreneurship is the only job that you will choose to work 100 hours in and willingly do it. And honestly, I've had people come up to me like, okay, so what's the next plan? Are you going to work for somebody? No, there's no way. I can't work for somebody else. It's not going to happen. Failure is not an option. And so, because I could not go back and work for somebody else. So for me, that's the best part of it. I might hit my head against a wall sometimes. A case might be really challenging, but I have to say those are the moments that are very humbling, because the moment your doctor thinks that they know everything is the moment you need to probably step away, because we don't know everything. We're human too. And I appreciate the difficult cases because they do allow me to go back to the drawing board and challenge everything that I know, because I don't know everything.
Yeah, and that's how you get to keep learning too, right? Because now you have to
Yep.
do more research and, figure out what, just a different type of a case or whatever. And the challenge is great because it allows you then to further your knowledge and to be able
Yep.
to add that to your toolbox of different types of cases that you can treat for sure.
Yeah, I felt like my brain was shrinking after I graduated and went into work in administration, because I had mastered my craft and there was no other level to achieve. In my work now, there's always something else. I think my brain is growing for the better part of it.
Yeah, no, definitely. I definitely agree with that, especially in this industry. I mean, holistic medicine is just, I think, after publishing this magazine for 17 years, I feel like, oh, I should have seen it all. Nope, there's always a new modality, new types of things that are ways that we figure out to treat people with, new supplements, all kinds of stuff like that. So it definitely keeps you on your toes for sure.
Mhm.
Well, we're gonna have to take a quick break. You're listening to the Dr. Diane Show with me, Dr. Diane Hayden. When we come back, we'll be talking more with Dr. Lyndsey about naturopathic medicine. Stay tuned, we'll be right back. We're back on the Dr. Diane Show with me, Dr. Diane Hayden. You can learn more about me at www.drdianehayden.com. And I'm talking today with Dr. Lyndsey Maher, and you can learn more about her at www.soleilholistic.com. That's spelled SOLEILHOLISTIC.com. Before we just went to break, we were just talking a little bit about, where do you see yourself in 5 or 10 years, and the types of patients that you see. And you said one thing to me actually offline that I wanted to make sure we circled back to. So when we talked about the types of like patients that were drawn to you or the type of cases that you typically see, you said something that I found very interesting. It was, well, we know that when someone has, and correct me if I say this wrong, but when we know when someone has type 2 diabetes or they're diabetic, they're still a person. It's the person first, not this person's a diabetic. So say it the way that you
Right.
said it, because it was way more eloquent.
So one of my professors, my first year of medical school, had said, naturopathic medicine specifically is about treating the person and not the disease. So somebody can have a diagnosis of diabetes, but they're a person with diabetes, they're not a diabetic. And I think it's very important because the way you talk and the way we use words really matters. Because as you had mentioned, we tend to become the things that we are frequently saying. So while I don't necessarily see anything specific or call myself a specialist per se, I do see people and treat people with the concerns that they have.
Yeah, I love that because as we were saying, people can get very attached for whatever reason to a diagnosis. And I think not even realizing that they're getting attached to it, but just by I have a friend right now who is going through cancer treatment for ovarian cancer, and she's actually an energy medicine practitioner. She's an intuitive. And so it's very interesting because just the way that she talks to her doctor, her oncologist, the oncologist has said to her many times, like, I almost don't know how to talk to you because like my patients don't talk to basically saying my patients don't talk back to me like you do. And
Mm-hmm.
so because my friend is saying to her, don't say those words to me. Like, don't say what you're saying, like about what happens if the chemo doesn't work or what,
Mm-hmm.
how many years and this, that, and the other. She's like, don't
Mm-hmm.
tell me those things because I'm not getting attached to this diagnosis. I'm
Yep.
a person. This is just a diagnosis. This is not me. This is not who I am. This is just something that's happening to my body. And so she's interestingly enough teaching the oncologist like how to just rephrase and talk to patients in a way that that I think doesn't make them get so stuck on what this is, what the diagnosis is.
Yeah, but we've created that type of an environment. And so it's really hard to deviate, right? Um, but yes, you're putting on a bunch of limiting beliefs,
Right.
and then that person takes them on. And so, not to totally deviate really, but the 4 agreements talks about that. And one of the first agreement is, oh my goodness, I think it's, be particular with your word.
Mm-hmm.
And it's important because if you're going to say something to somebody else, a lot of the times it is about you, not so much the other person. That's another thing too. But that other person doesn't know that. And so they're now going to take on something that you've impressioned upon them. And all that's very important. And he actually talks about, black magic versus white magic. And so that's also in how you say your words too, is either you're going to put a spell on somebody that's going to have negative consequences, or you're going to put a spell on somebody that's going to have positive consequences.
Yeah, because I think the body's always listening, right? Like
Mm-hmm.
whether
Yeah.
you believe that or not, your
Mm-hmm.
body, your brain, everything, you're listening to the things you tell yourself and the things that people say to you always.
Yep. Deepak Chopra's book, I want to say, is it, I forget, the Healing Brain or something like that. I'm probably botching that, but he even talks about radical remission for people who have cancer, who went in with all these tumors, and got the scans, and they went home, changed their mindset, did some things, and then come back like a month or so later and all the tumors are gone, and their doctors just can't explain it. And I think that's part of it, is that if we don't have an explanation for it, then it didn't happen.
Yeah. Except the scans show that it clearly
Right.
did.
Right.
Oh my gosh. So we just have a few minutes before we finish today. I wanted to just ask you a couple questions that are a little bit more personal, on the personal side. So what books or podcasts are you reading or listening to right now that you love?
So I did just finish the 4 agreements. Usually I'm always hearing, so I have about a 45 to 50-minute drive to work. So I've probably read like 100 books this year, just because they can occupy my time in the car. But it's a good chance to do that. So Happy Pocket Full of Money has been really a big one that I kind of do on repeat. And it really reinforces just mindsets, and it's kind of the same things that we've been talking about. And once you hear something so many times, if you were hearing the opposite of it for your lifetime, and now you're hearing this more positive component of it, it just, that book reinforces it. He repeats. And so I like that. And then I just put back Outwitting the Devil by Napoleon Hill. He's like the OG law of attraction manifestation guy who wrote Think and Grow Rich. And so that
I've
was
read
a
that
hard
book.
one.
Yeah. What's this
So
one
he wrote
called?
Outwitting the Devil.
Okay.
Yeah, it's actually, the book is ahead of its time, but he wrote it in the 30s. And basically it's, he puts the devil on trial, and the devil can't lie for anything that he says, and or to any of the questions that Napoleon Hill asks him. Napoleon Hill had died, I don't want to say shortly after, but I do know that his wife and family told him that he should not publish this book because it's so taboo to talk about the devil, especially during very Christian, communities and at that time. So when he died, it went to the Napoleon Hill Foundation, or at some point, and it was never published until the wife died and the niece died. And they eventually brought it to publication like 10 years ago, I want to say. But it's pretty wild because as you're listening or reading it, it sounds like he's here predicting all the things that are happening in the world right now.
Oh my gosh, that's amazing. I'm gonna have to get that one.
Yes. So that one's a good one. And then I do a lot of, for podcasts, I do a lot of medical podcasts. I can't say there's anything fun there, but it's a good way to get my research in.
Yeah, for sure. So obviously all these things help you as far as just your mindset and your goals and in your career, but anything else any other words of wisdom that you want to leave us with that help guide you and, just how you've been able to be so successful so far?
Listen to yourself, even if it sounds crazy. I talk about how I was probably always a black sheep in my family, but the black sheep always end up turning out to be, something. I mean, they're different, but not in a bad way. And so I think never try to put somebody's goals and aspirations like down just because you think that they can't have them or it seems too unattainable. But I always say that it's in the same thing in medicine with my patients. You always aim for the moon, but it's okay if you reach for the stars, because if you didn't even have that goal, the post would have moved and you wouldn't have even gotten as far as you had. So I think that's a big thing, both in personal life as well as health and wellness.
Yeah, that's great. I mean, honestly, I think a lot of us have kind of, and you said this earlier, have just maybe forgotten to set goals or forgotten, just to dream. And, that's just, it's something that's so important, I think, because it's really what keeps us vibrant and keeps us, full of life and going.
Yeah. And I think our childhoods have been robbed a little bit too, because we're always being asked, what do you want to be when you grow up? But why can't I just be a kid right now? So same questions still apply. I still ask people what they want to be when they grow up, because I'm not really sure you ever do.
Yeah.
But it's okay.
That's true. No, I think it's totally okay.
There's a misnomer associated with that. It's like, if you're not an adult by this point, but I don't know, but I think also we're always growing up because we're always growing. So why stunt it and try to say that once you've achieved adulthood, that's kind of where all the stops get placed.
Yeah. No, that's just the beginning. Well, I want to thank you, Dr. Lyndsey. This was awesome. And again, people can learn more about you at www.soleilholistic.com. Thank you again so much for all this great information. I appreciate you being on the show.
Thank you so much. I loved that you had me on today.
Yeah, it was awesome. And I want to thank all of you listeners for tuning into the Dr. Diane Show. Please join me the first and third Thursdays at 11 a.m. Eastern, 8 a.m. Pacific. Next time, we'll be discussing more about the power of thoughts and beliefs and the impact they have on your life. Have a great week, and I'll see you back here next time. Thank you for tuning into the Dr. Diane Show, revolutionary expansion of mind, body, and soul with me, Dr. Diane Hayden. Tune in every Thursday at 8 a.m. Pacific, 11 a.m. Eastern on transformationtalkradio.com. Center your thoughts on what you want and shut the door on every suggestion of fear, worry, or lack from your own consciousness or the consciousness around you. Once you master that, everything is possible. To learn more about me, Dr. Diane, and receive a free digital subscription of my magazine, visit naturalnutmeg.com.